Assalamu alaikum, my dear fellow dentists. Hope you are all okay. In this video, I will discuss about some points about salivary gland. And the salivary glands are of two types: the major and the minor salivary glands. And there are three pairs of major salivary glands, but the minor salivary glands are numerous. There are 600 to 1000 in number. The major salivary glands are namely parotid, submandibular, and sublingual, but the minor salivary glands are not named. And the major salivary glands are mainly parotid glands are developed from embryological origin, that is, are ectodermal origin. But the other salivary glands, including the minor salivary glands, are endodermal in origin. Endodermal in origin. Parotid gland develops on 6th week of intrauterine life, also the submandibular, but the parotid develops fast, and sublingual developed on 8th week of intrauterine life. The secretion of parotid glands are purely watery, that is serous. The submandibular gland are mainly mixed, but they are predominantly serous, but serous then mucous. They are mixed, but parotids are purely serous, and the sublingual are predominantly mucous. All minor salivary glands are mucus secreting except von Ebner, which secretes serous secretions. The parotid gland located in relation to external air, angle of the mouth, that is angle of the mandible, and mustard process. A submandibular gland located in the submandibular fossa close to the angle of mandible. Submandibular fossa. The sublingual fossa holds the sublingual glands, which is on the base of the mandible. The parotid and the submandibular gland are enclosed by investing layer of cervical fascia, but submandibular is not enclosed. The parotid gland's duct Stensen's duct opens into the vestibule of mouth opposite to the upper second molar. The submandibular gland opens on the papilla on sublingual fold in the floor of the mouth. Sublingual fold in the floor of the mouth, that is called sublingual caruncle. Submandibular opening is sublingual caruncle, and 10 to 12 ducts open on sublingual fold. That is also the sublingual caruncle. The sublingual glands open. The duct of Rivinus and duct of Bartholin are the ducts of sublingual gland, and duct of Wharton's is duct of submandibular gland. And in the duct of Rivinus, there are 8 to 20 in number. They arise directly from the sublingual gland. They individually open into the floor of the mouth along the sublingual fold. This is the sublingual fold. Imagine this is the tongue when you raise it, and this is the sublingual fold. They open there, and the Bartholin duct, the main duct of the sublingual gland. It is larger than Rivinus duct of Rivinus. Instead of opening separately, it joins with the submandibular duct. This Bartholin ducts open with Wharton's duct, and they open together in sublingual caruncle. This is the caruncle sublingual two pairs. They open there. Secretomotor root of the parotid gland comes from ninth cranial nerve, where sympathetic comes from middle meningeal artery, plexus around middle meningeal artery, and sensory development from auricular temporal nerve. This is the parotid glands, and the secretomotor of submandibular gland is from cranial nerve 7 and sympathetic root from facial artery and sensory from lingual nerve. In case of sublingual gland, the secretomotor root from 7, again from facial artery, plexus around facial artery. This is the plexus around facial artery, and also the lingual nerve. Those are the same. Submandibular and sublingual, secretomotor and sympathetic are the same.